But it is my pleasure to have been asked to give this address at this 5th Annual General Meeting of the Caribbean Broadcasting Media Partnership on HIV/AIDS. This meeting is coming at a time when the people of the Caribbean are celebrating the significant achievements of our athletes who have won an unprecedented number of 18 medals at the recently concluded 30th Olympiad in London. These include 6 gold medals and one of the 3 world records broken in track and field. Although the total number of medals does not match that of countries like the United States, China, and Russia, Sir Ron Saunders, who is quite known to you as a respected commentator, in his article reproduced in several Caribbean newspapers over the last weekend, poignantly illustrated that on a per capita basis, the Caribbean actually topped the list. In the New York Times yesterday, 13th August, the sports statistician confirmed that based on population size, Grenada tops the medal list. Hold it. Followed by the Bahamas and Jamaica. With Trinidad and Tobago in 5th place, and the United States of America in 23rd. Now, these performances are heroes, chief among them, the living legend, Usain Bolt, and Shelly-Ann Fraser-Price of Jamaica, Kirani James of Grenada, Kishorn Walcott of Trinidad and Tobago, and the Jamaica and Bahamian relay teams. All these must be celebrated. But in celebrating, I think that it is important for us to note that we have to be inspired to levels of endeavors in our respective spheres. Nothing less than gold, for example, I mean gold, would bring about an AIDS-free generation. For it is a generation characterized by the virtual elimination of mother-to-child HIV infection, substantial reduction in HIV incidence, and timely access to life-saving therapy, which includes the best available drugs. A very tall order. And for the skeptics, this is wishful thinking, a dream even. But we dare to dream. We dare to dream of an AIDS-free generation because we believe it is achievable. It is our goal. It is our gold. The recently concluded 19th International AIDS Conference in Washington, D.C., at which the Caribbean Broadcasting Media Partnership on AIDS played a prominent role, highlighted the fact that at no time before has there been so much optimism about the possibility of an AIDS-free generation. Deaths and infections are down in those parts of the world most ravaged by the disease, while the number of people on treatment has risen 20% from 2010 to 2011, reaching 8 million people in needy countries. In these past 30 years since the first diagnosis of AIDS, we have turned back the tide step by painful step. But painful yet hopeful steps by activists, community leaders, the media, among others, have today enabled a global response that has reached significant landmarks evidenced by greater access and more affordable antiretroviral drugs, transformed drug development, involvement of patients in clinical research, reduced stigma against and increased understanding of key populations, including people with AIDS, men who have sex with men, commercial sex workers, and drug users. Cumulatively, these have halted the overall spread of the disease and its most dastardly and disastrous effects, especially on the developing world. In the Caribbean, for example, incidence of new HIV infections has been reduced by 14% between 2001 and 2011. In the same period, an estimated 67% of people with AIDS have access to antiretrovirals. Prevention and treatment programs have cleared the way for the region to become the first in the world to eliminate mother and child transmission by 2015. This is not a pipe dream. In some countries, like St. Kitts and Nevis and St. Lucia, there has been no recorded incident of mother-to-child transmission since 2006. Yes. There is much to celebrate. But in the Caribbean, we still remain second only to sub-Saharan Africa, with 13,000 new infections, including 1,100 of newly born children in 2011. There are still alarmingly high rates of the disease among men who have sex with men, as much as 33% in one country. Increasing rates among youth between 15 and 29 years old, and women and girls, in the latter case because of sexual abuse, is indeed a concern and in need of accelerated action. There is therefore no room for complacency. While we must celebrate the fruits of the sprints which have so far reminded us that yes, we can, the marathon is still to be won. There is still much work to an AIDS-free generation. There is work to ensure that there are no reversals in the gains so far made. Work to ensure the special needs of key populations, including the disabled. There is also the need to recognize the elimination of stigma and discrimination is an imperative. We have to pursue the resources to sustain these activities if we are really to get to the goal. Of course, one of the biggest boosts to the achievements of an AIDS-free generation would be the discovery of an HIV vaccine, which scientists at the 19th International AIDS Conference believe is within reach. But in the meantime, we must respond aggressively to the challenges which stand between us and our goal. Now, what are these challenges that confront us? As we reach for gold, the lessons drawn from around the world have demonstrated the need for innovative solutions to practical problems. The political declaration resulting from the United Nations high-level meeting on HIV and AIDS in 2011 agreed to achieve targets for HIV prevention by 2015 in an effort to reach zero new infections. the conversations taking place point to several requirements for achieving that goal. Among them, first, combination prevention, which, based on the evidence, is most effective when it includes a mix of biomedical, behavioral, and institution elements tailored to the local epidemic, as well as to the notion of treatment as prevention. Secondly, financial and technical resources to support programs requiring diversified funding sources through shared partnerships to fill resource gaps and to ensure sustainability. Thirdly, and this would concern most of you in this room, strategic information that helps to deliver the greatest returns to investment. And then finally, empowering people to overcome stigma and discrimination, which are among the major factors fueling the epidemic. In this respect, the Caribbean has established a number of responses to these challenges, and in this regard has demonstrated a model that is unique in the world, in much the same way as Jamaica has developed a system that continues to produce sprinters of the highest international order. The establishment of PANCAP approximately 11 years ago has been recognized as an international best practice. And most of you would know that this is so because of the unique accumulation of partners from government, private sector, NGOs, and developing partners. PANCAP has functioned effectively through a coordinating mechanism as a hub of a network, as well as a regional strategic framework around which to mobilize resources. It has demonstrated, in fact, what we can call the value of functional cooperation to achieve common goals. Now, in this respect, in response to the challenges, I would say that PANCAP has shown some courage and initiative. It has advanced combined and combination HIV prevention activities through the Caribbean Epidemiological Center, one of its core partners. It has mobilized financial and technical resources, mainly through its development partners. It has provided strategic information through its collaboration with universities and other policy partners, and empowered people through its NGOs and civil society connections, chief among which the Caribbean Vulnerable Community Coalition, as well as it's anchored, as we will see shortly, by CBMP. Since its inception, CBMP has played an invaluable cross-cutting role in PANCAP's orientation and strategic direction. In the current context of financial constraints, however, CBMP's strategic planning activity has indicated its four main programmatic objectives, and they are important: innovative messaging, training of broadcasters, expanding partnership in the multi-sectoral response, and financial sustainability. The realization of these objectives, no doubt, will play a critical role in the region's achieving its goal of an AIDS-free generation. So, what are some considerations for CBMP and the broader media grouping gathered here today in the quest for gold? The underlying factor for consideration is that the future is now. The future is now. The current conversations and decisions must focus, therefore, on what is CBMP's comparative advantage within the community. At another level, how could it engage the wider Caribbean media to support its programmatic objectives and to make more robust its comparative advantage? and as it accelerates its response in its contribution to an AIDS-free generation, which target groups are primary and immediate and which are strategic? These are just an example of the questions for which appropriate answers would no doubt make even clearer the strategic directions and establish the innovative basis for attracting resources for this sector of the response. And I believe in what President Clinton said in the closing session of the International AIDS Conference meeting just concluded in Washington. He said, with innovations, and I put this in now in the quotation, like CBMP, we can afford to take the chance for being champions of change, and the money will come. In all of this, stronger strategic partnership is more tightly knitted. It is more tightly knitted, and it is a cohesive tapestry that seem to be resonating and resonating in the factor on a track race. I really meant on a racetrack. A track that also fully utilizes the information and communications technology and in tune with some of the recent developments of Caribbean Connect and even some of the newer technologies that CBU are interested in. Indeed, CBMP's decision to accelerate its program with the social media and to collaborate with key populations, and in particular to involve the Caribbean Vulnerable Communities Coalition in the planning and delivery of the specific element, is strategic for more than one reason. First, including the voice of the marginalized is critical. Secondly, creating openness and innovation in the discussion on eliminating stigma and discrimination may yet prove to be the biggest area where there is the greatest success. And we must continue this trend. In its discourses on the critical importance of strategic information and communication, the 19th International AIDS Conference called for more research that was, among other things, relevant and easily utilized. In this area where CPMP could cultivate partnerships, it could integrate the strands of biomedical, behavioral, and policy research by the region's key institutions and bring to bear its comparative innovation designed to create a thrust that is meaningful. In fact, it is important that we realize that we must stamp out the culture in which research in many cases do not see the light of day. They remain in files, in closed files. To turn the tide, to end AIDS, we have to change the culture. Then, ladies and gentlemen, I posit and challenge CBMP to become an even more integral partner in the plans for the establishment of a regular Caribbean conference on HIV/AIDS. Because it is such a conference that could build on the activities of our scientists, our policymakers, our practitioners, and our media workers. In this way, it would help to create the environment of engagement of all stakeholders and contending ideas, practices, and policies that help to transform the approaches and attitudes towards an AIDS-free generation. But I hasten to acknowledge that successful partnerships require much more work and dedication. It requires also adjustment by agencies in terms of viewing issues from a broad perspective and creating trust and meaningful dialogue across agency and organizational boundaries. A clear vision and creative leadership are key to success and achievement of this goal. CBMP's annual report for 2011 to 2012 is compulsory reading. It provides an impressive array of achievements. The report of CBMP's strategic planning activity further identifies a solid vision and a consciousness about the strategic objectives of messaging, training, partnership, and financing. I would like to take this opportunity to commend CBMP for developing and sustaining a network of broadcasting partners, according to the report, 106 stations and 24 countries, with a daily commitment for broadcasting dedicated messages to reach diverse populations. I think for that, we all deserve a round of applause. CBMP's Live Up brand is a significant mechanism for enhancing information, education, and communication that is far-reaching. Its Testing Day initiative has now become institutionalized, and the evidence of its impact on the region's preventive efforts is now being seen. Its use of Twitter, Facebook, and YouTube demonstrates that it is cool and relevant. Its strategic partnership with foundations like Kaiser and Elton John and Ford and others have yielded valuable resources for which the region has had the benefit. Its role in carrying programs at the 19th International AIDS Conference targeted to sex workers, drug users, Caribbean migrants on homophobia allowed the Caribbean stories with their achievements and special challenges to be highlighted in an international forum. And this is significant. Without CBMP, the voice of the Caribbean at the IAC would have been muted, and the face of the Caribbean would have been an oblique imagery. In fact, I thought as I was there at the IAC, if it was not already a reality, we would have had to invent the Caribbean Broadcasting Media Partnership on HIV/AIDS. As a designated champion for CBMP, I am fortunate to be associated with such dynamic and creative leadership. But I challenge CBMP to increase its pace in the race that must conquer the most difficult aspect of the HIV response. That is, eliminating stigma and discrimination. Elimination of stigma and discrimination, in fact, sets HIV/AIDS and differentiates it from other diseases. And this is an important challenge that we must confront today. A race that revamps the existing status quo with new innovative approaches. An agenda that includes all, including the disabled. A race that requires, particularly at this juncture, an even higher level of corporate responsibility and shared values. Because investment in AIDS is something so important for bold and decisive leadership. It will take no less to achieve gold. Challenging but exciting times are ahead for CBMP, as it is for all stakeholders in this room and outside, but stakeholders working together to achieve the end of AIDS. Bolt has asked me to tell you, go for gold. Thank you very much.